Good morning and welcome again to Pain to Power right here on Legends 100.3. Mike McGann with you as I always am, and as always, it's going to be a fantastic show. This program is brought to you by First Rehabilitation of North Palm Beach, which is right here in North Palm, basically across the street from Legends Radio. You can learn more about First Rehabilitation of North Palm Beach by checking out their website, which is very simple, firstrehabnpb.com. Right out first, FIRST, rehabnpb.com, or you can call them at 561-624-4263, which also works out to 561-624-GAME, because they keep you in the game, and 561-624-HAND. So Dr. David Kashuba, my friend Dave, who's the owner of First Rehabilitation of North Palm Beach, did you intend that phone number? Like, did you get game or hand and having to figure this out, or did you get the number and then it just was like this magic?
Good morning. How are you? So
doing great.
not to avoid the question, serendipitously. But a friend of mine, if she's listening, Linda Kiernan, a fantastic hand therapist. Thankfully, she retired. Otherwise, I may not be in business.
There you go.
She's very good.
Congrats on your
retirement.
retirement.
She went on a business a while. She retired,
okay.
And she gave up her number, and it was 624-HAND. And I'm thinking, back then, Dr. Frank Cook and all these superstars were sending, and they wouldn't remember the phone number, but they'd remember 624-HAND. So sure. I saw that she retired, so I called up and I said, hey, I wonder if I could have this number. And she's like, sure. So I started doing, then as I grew a little bit more and started doing sports medicine, I realized the same numbers spelled game. So
I just love how that comes together.
Yeah. So it kind of spreads out a little bit more, where I could get a little bit more. I could get hips and shoulders and everything else, not just hands.
It all makes sense, though.
That's right.
I had a friend when I was young whose number was 627-GOAT. I don't know how she figured that out, but she told me, like, I never forgot that. I can't remember the girl's name now.
Was she?
That was her number. She was cool enough.
Yeah.
She was my boss all right, it's a long story.
Yes, okay.
But we've got a lot to cover here at Pain to Power today. And Dave, for anybody that's brand new to this, and I know that we do have some people that are tuning in pretty consistently, but for anyone brand new, what is First Rehabilitation of North Palm Beach all about? What do you do there?
Well, what we do is we try to take each person individually and figure out a game plan for them. And again, you can't cookie cut what programs you're going to do. If someone
Sure.
comes in with back pain, sometimes it's not just back pain. A few shows ago, we found out that it was a cauda equina syndrome that could have killed the gentleman.
Yes, that was amazing.
But other times, if you have a good therapist, a good person looking at them, you realize that it's not back pain. And that's why I brought a friend of mine. He's been around for a while, and actually he's one of the guys that took over Frank Cook's practice.
Oh, okay.
That's why I wanted to put a dib in for him. He's a fantastic surgeon, and he geared away a little bit. If you see Dr. McVicker, Dr. Zach McVicker, for your shoulder or your elbow, he's as good as anybody. But what he loves is hips.
Right.
I mean, doing surgery on hips. Let me just put that out there.
That's probably an important distinction.
So there's something that we see a lot, and people will come in and they'll say, Dave, I have a lot of back pain.
Mm-hmm.
And it turns out, we find out that it's a symptom that we look for, and it's the pain's going more towards the groin than down the leg. But it's similar. It's something that's called femoral acetabular impingement, or FAI is what we go by. And it's hip impingement. And kind of in layman's terms, what it is the hip socket develops too far over the top of the femoral head.
Okay.
So you get an impingement. And what I would like to do is just, some of the symptoms. Of course, people will start having problems even with gait, with hip flexion.
Sure.
Again, painful in all activities. Any kind of torque pressure that's put on, or weighted pivotal pressure like golf, things
Sure.
like that could cause problems. And the guy to go to in the area, especially, and when I say sports minded, we have 70-year-old sports-minded people that are playing tennis that are having this syndrome for the first time.
It's incredibly active here. I mean, this is a big thing.
So I send my hip people specifically to Dr. McVicker. I'd like to introduce him, and he could tell you a little bit more what he does, where he's found. He works for Paley Institute now. They're lucky to have him. And, tell us a little bit about yourself, Zach.
Oh, thanks for having me. So I joined the Paley Institute from Frank Cook's old practice in 2022, okay. I believe, and developed their sports medicine program. So they didn't have a sports medicine physician at the time. And they do a lot of hip preservation over there already. And so what I did was add a little bit more to their program that they had. They didn't have anybody doing arthroscopic surgery there for hips. And, amongst the other sports medicine pathology that I treat, really dove into that. And like you said, there's a lot of different symptoms that can happen with hip impingement. And so sometimes you got to think outside the box with it, and that's what I really like about it. It's more of a puzzle, and you have to figure out where the root problem is. It's a big thing now, is everybody wants to get down to the root cause. And for hips, a lot of times it's causing the back pain, it's causing the groin pain and other symptoms that you're having.
Right.
It's really interesting because a few years back, it would have been 2019 or 2018, I guess. I was having a lot of back
Before
pain.
a mask or after a mask?
This is pre-mask.
Okay, that's how we could relate to times.
Yes, exactly. The PM and PM, like if it's pre-mask and post-mask, we need anti-mask. Okay, but that's not ANTI, that's ANTE.
I plead the fifth.
Probably for the best in this case. I went into a chiropractor and had some X-rays done because I've always had a lot of back issues, and they said, "Yeah, your hip is frozen." And it's probably been in that position for years. And a couple years later, I went and looked into that. And I had someone actually get it out of that position just with chiropractic. And it was amazing what that did for me. So if that had been much worse and required a surgical intervention of some kind, right. That's something you've got to look into, because that caused me problems all over the place, lower back, upper back, all down that side. It was really bad. And it was just something in the hip that caused all of that. So, these can affect so much of your life, your lifestyle and all that. But, thankfully, you're there at Paley to deal with that, Zach.
Yes. Common complaint, people are unable to move their hip. Unable to walk. It stops them in their tracks. We touched on the back pain. It even goes as far as people are getting pelvic floor dysfunction. Some of the muscles that are involved with the pelvic floor can have some dysfunction there too because of the hip problem. So, there's a lot of different symptoms that can come from that, and it's important to get down to that.
It really is. It's amazing to me how that one can just radiate out like that and cause so many other problems.
Sometimes it's genetic, because you could have a femoral head and neck problem along with the socket, but normally what you see, it's probably more from athletes, right? And athletes, when looking into it, the ones that we see are more of the ones that they play basketball, they're gymnastic kids and adults, young adults, runners, especially marathon runners, and I have a question. I was asking some of my other physical therapists, and with the difference between a male and a female when you see them. Now, a male setup where everything's tight, where a female's hips are wider. They have a wider, what's called Q angle. Mm-hmm. And with men, the tendency is, at least research-wise, they'll start developing increased bone on the actual ball, where the women will develop increased bone on the inside of the acetabulum, or the receiving socket. So which one do you see? Does one recover better than the other? Does it have influence on how you do your surgeries?
Yeah, absolutely. So the cam lesion is what you're referring to, as far as there's two different types of impingement. There's a pincer lesion, which is the cup, the acetabulum is covering too much of the ball. And then you have the cam lesion, which is the ball is misshapen. So I like to tell people that as a visual, instead of being round, it's more like an oval peg in a round hole. So there's a mismatch there.
Square peg in the round hole.
Yeah, so it helps to kind of give a visual to that, but it's truly a mismatch between how the shapes are and how it's supposed to move and function. And so females do have a higher tendency to have pincer lesions, the over coverage there. and males more of the CAM, but they both happen. I've treated both in different sexes, and as far as the treatment of that, the pincer lesions are technically more challenging to treat. They often don't have a labrum; it becomes calcified, and we have to do certain techniques called a reconstruction of the labrum that we can get into as well. But it's a lot more challenging. You need to be very, very experienced with this to be able to treat those effectively.
Right. Now the labrum is the cartilage on the inside, right, on both the ball and the receiving socket, correct?
The labrum is, think of it like a gasket. So if you have two pipes, you're thinking of a gasket that's creating a seal. And for the hip, it creates negative pressure so that when you walk, it spreads the contact pressure, the weight throughout the whole dome.
Sure.
And so if you lose that suction seal, you're going to lose the pressure, starts increasing pressure on the cartilage in there. So it's more like an extension of the cartilage, which is like and forms a gasket around the ball.
Right.
It's interesting to think about that, because you think about that think about what your torso weighs, the top half of your body, and then the weight that those joints have to carry every step, the impact, all of it, running, right? If that's getting worn down and that force is not being distributed equally along that dome, which is a classic dome construction, it's going to wear away so quickly. It's putting so much more pressure and effort on that joint. I can see why that would have such a wide net of negative effect on the body. You're asking it all of a sudden to carry so much more weight at specifically targeted areas.
Right, especially if the labrum is involved. It's going to hurt it can be every step that it's hurting. You're kind of dragging your leg behind you. So it's very painful.
When should someone reach out to you, for instance, Zach, to find out, what would be the symptoms you would say, okay, it might be time to call Zach McVicker over at Paley Orthopedic. What would lead to that?
Yeah, so I think that growing pain, number one, that's the most common symptom. But the other things, low back pain, SI joint type pain, so pain kind of towards the buttock, pain on the outside of the hip, anything like that. If people can't find a reason for these things, happy to take a look and see if the hips are an issue. But oftentimes they are.
And if you're mentioning things that could have an effect like on pelvic floor as well, that's a whole other host of problems that none of us want to have.
No, people usually get in a little quicker when that starts.
I would say once that happens, people are going to make that call. That's really, it's amazing how widespread the issues can be from a problem in a simple ball and socket joint.
Yeah, right.
Little things that you could also do. Just if you're starting to get a little bit of the pain, you want to avoid sitting with your legs crossed, repetitive bending, modification of tasks. It all depends on if it's more important for you to do something like golf specific. Okay. There's ways to change your golf swing and modify your swing where you're not doing the torque pressure to the hip. And there's a lot of different exercises that I'll go over that you could do. But ultimately, if it's starting to get painful, and like what Dr. McVicker said, that and the actual seal or the labrum around is broken down or it has a tear, you're starting to wear away at the hip, and you want to get it before you need to see one of the future doctors that I'll have on that do total hip replacements, because the recovery from this, you feel completely normal. Okay. Once you're good, and you and I know that we get the athletes from you, and they're back running, they're back doing what they like to do and what they're able to do quickly.
Yeah, absolutely. The recovery overall is a little longer as far as return to sport than maybe a total hip would be, but much less painful. It's very minimally invasive. It's arthroscopic, so little cameras. Little poke holes, and with the total hip, you're getting back feeling pretty normal pretty quickly as far as a total hip can.
Sure.
But it's not your own hip. You don't have the proprioception and kind of the balance and stuff that you would do with your native hip. So
look into it early. I think that's kind of the bottom line here: is don't let this stuff get away from you.
Yeah.
Dr. McVicker, you can be reached by calling Paley Orthopedic and Spine Institute. The number is 561-844-5255. That's 561-844-5255. You can go right through the prompts and you will reach Dr. McVicker's administrative assistant. Her name is Lisa Lewis, and you can let Lisa know.
Lisa gets more compliments than I do. Everybody loves her. She is phenomenal. So
I love it.
That's nice. That's good. How many? Oh, that's huge. And one word that Dr. McVicker said, Zach said, is proprioception.
Okay.
And I like to tell people if you close your eyes,
Okay.
right, and you put your hand to the side, and I lift your finger up, and I'm doing the lifting, if you could tell without looking if it's up or down. Because
Really?
people lose that. They do lose that. And the proprioception, especially in the lower extremity, cause you to misstep. And once you misstep, you're more likely to fall and then have other complications.
Well, we know, I mean, just to bring it to hips again and think about the senior community, I think we all know that once that hip break happens, there tends to be a really strong domino effect from there. We see decline so rapidly. You've got to take care of your hips. I mean, this is a marvelously important thing. I didn't even realize quite how important until we started having this conversation today.
Yeah, I talk to patients every single day about this, about, your hips and your pelvis are your foundation. Kind of everything is built off of that, the curve of your spine, everything. So, staying strong, staying flexible through your hips and the pelvis. The pelvis is a ring. If you're causing abnormal torque across it, it's going to create problems throughout. So it's really important to stay healthy throughout the hips.
I think I need to see everybody that's ever been on this show at this point. But this one in particular, because again, the core of that really does have so many other effects. And I'm actually a little freaked out.
Especially in male, I tell people when they're wearing a belt, if the positioning of the pelvis is key. And if you're wearing a belt and your belt buckle is facing down, not from your stomach, just from the way that your hips are aligned and your pelvis is aligned, that means you're going to have, if you don't, you're going to have hip pain soon.
Absolutely.
And when men have hip pain and they have problems with the hip and they fall, the likelihood of them to break a hip is far less than a female. Women, because of the way their Q angle is and the way the widened hips are, they have more of a laxity than men.
Okay.
And so they have to be a little bit more careful with making sure that you don't poo-poo back pain or groin pain, and you come see us. Again, I do free consultation. It takes me all of 10 minutes for me to sit down with you and go over a little bit about your symptoms, and so that way I know whether to send you to Zach or send you to go see a back doctor or an orthopedic that specializes in something else. So that's kind of where it's good to go to somewhere that has a good physical therapy team, good occupational therapy team. Paley Institute, they're excellent. Their specialty down in West Palm Beach, and the people that they hire are all nothing but the best as well. And not to say that we're the only place to go, but do your research before you go. Don't listen to the lady at the water cooler or in Publix line.
Oh, boy. But that's one of the nice things about First Rehabilitation of North Palm Beach, Dave, is that it's like a hub. You've got everything there for physical therapy. It's state-of-the-art. It's a great office. It's a beautiful office. And you are amazing at everything you do there. But you're connected with professionals who can handle next level of that kind of thing, from surgical and other next steps. And you know all of them, and they're all affiliated with you. So you will refer to the best person for the job if it's beyond what you would typically do at First Rehab.
And one thing, and again, kudos to Zach, is sometimes at 8:30 at night I'm thinking about a patient and I'll text him, not expecting a text back, and ding, and I get one back and he's like, "Yeah, Dave, I agree," or "I disagree," or "This is what we should do," and not that but it's important. It just shows me that not only does he love what he does, he cares who he treats and what the results are, and that's important. That's the follow through, and the follow through is key. And for him to give a little shout out to Lisa,
sure,
that's something important. Lisa, I think you're going to get busier and busier.
Yeah. Right.
And that's something. But also, now you still have Tyson working with you.
Yeah. Liam is my PA.
Liam.
He does a great job. He's been with me since I moved over to the Paley Institute.
So
another common thread I see here is the seeing of people as people, and I see that all over the place with your practice, Dave, and that's always been a thing at Paley. So, Dr. McVicker, having you there to continue that tradition, because it's not about all right, this is numbers, but this is a human being, and these are this is how I can make their life better.
Right.
You know, it's the humanity of it that is often lost these days, but
Yeah.
the focus is still in the right place when you get this team.
Yeah, we're in a really fortunate situation with the Paley Institute, and I'm able to dedicate a little bit more time to people. This stuff is not easy. It's very, very complicated.
Sure.
It's very intertwined. So you kind of have to listen to people a little bit longer, and you have to care because they're going into different stories and stuff, and it may not be pertinent, but you realize it actually is at the end of the day. So you got to keep an open mind and have to pay attention to people a little bit more.
The numbers again, by the way, to call First Rehabilitation of North Palm Beach, easy to remember: 624-GAME or 624-HAND or 624-4263. It's all the same number. And Paley Orthopedic and Spine Institute to reach Dr. McVicker, 561-844-5255. Go right through those prompts till you reach Lisa Lewis, his stellar administrative assistant, and they'll make sure that everything goes in the right direction.
She will sign a picture as well.
Yeah, I think people are just going to call just to talk to her and see how good she actually is.
Honestly, I'm going to have to look her up.
Yeah.
Yes, yes.
But, but again, there's the humanity of it all. We're having just a human conversation here about all of this, about very human problems and solutions to them. And I think that's a refreshing take. What is the most common hip issue that you see? Because we talked a bit about, the issue with the pincer, the cannon side, right? Mm-hmm. And what that's all about. What's the most common thing that you see?
Yeah, so that's the most common, but we treat really, really complicated things.
Okay.
There's something called hip dysplasia, which is,
Yes.
kind of the second most common thing that I see, and that's the exact opposite of what a pincer lesion would be. So instead of over coverage of the ball, the cup is underdeveloped. So you're point loading on the cartilage because there's not as much spread out throughout the dome. There's not as much dome to spread it out. So that ends up in arthritis 100% of the time because it's edge loading, and so then people tear their labrums pretty early on, and they get hip pain. It causes a lot of other dysfunction too. In the same way that FAI does, it causes a lot of soft tissue stress. So we treat a lot of hip dysplasia, and that's more of like the typical one would be like a gymnast or a dancer, who has been dedicating 5 hours a day for years and years and years while they're developing, because of the stress of it, and that's the kind of the typical patient that we see.
I honestly, I had a dog that had hip dysplasia.
Yeah.
But it was amazing to see what that did later on in her life and the problems that she had from that. And the pain pills that she had to be on, all these things that affected her quality of life. And we live far more complex lives as human beings than our pets do.
Right.
We want to make sure that we're able to do these things, have fulfilled lives and full lives to the best that we can, without having that pain, without having those other issues. But the solutions are there.
There. Yep, absolutely.
When I die, I want to come back to be a dog that my wife owns.
Yeah.
Because she doesn't care about Dave. She cares about her dogs. One thing, don't let your little dogs jump off the couch.
Now I might want to come back as a dog that Dave's wife owns.
So, well, some of the things, though, getting back to what you want to do, if you start developing a little bit of hip pain, a lot of times there's a muscle called the gluteus medius. Gluteus medius is weakened. And some of the exercises that I spoke in the past are sit to stands. You do sit to stands, but this time you put a band around, a TheraBand or a rubber band around the knees, just above, proximal to the knees, and you do the sit to stands. So if you have a hip problem, you have asymmetrical weight shift on one, more on one than the other. So if you add a TheraBand and you do the same exercises, it stabilizes and makes you equalize. The other thing is that standing on the back of the chair, you're doing the leg extensions. You're doing the very important leg abduction. So you're kicking away from midline. Working something called we call them clams. You want to work the strengthen the external rotators because the external rotators are very weak. It's a very unnatural thing for a man or a woman, a person to do is to strengthen their external rotators. So if you think about it, if you lay on your side and you bring just one leg up, that helps it doesn't directly work the gluteus medius, but it helps. Doing a band around the knees while you're lying supine helps as well when you spread your legs apart. Stretching your hips, a simple way is you lie prone or you lie on your belly and you do what they call, I think it's called a cobra, where you push up from your arms and you keep your pelvis down on the floor. When you get on the floor first, make sure you're able to get back up. or call Mike.
I'm on my way.
And we'll tell an interesting story that they're asking Mike about hand therapy, but we won't get into that today.
Yeah, that's a good point.
So we wanted to ask, and I know Mike usually does this, but you're just the scientific approach of what you do. What's your favorite story of what you've seen, who you put back together, and the outcome?
Ooh.
Put you on the spot.
Yeah, you put me on the spot here. Oh,
Tough. I mean, there's a ton of them, right? But
yeah, there's a ton. I mean, I think the kind of the typical one is an athlete. Actually just had somebody very recently. They're told your career's over. You're in high school. They have aspirations for further.
Wow.
Going on further into college or professional, and they get told nobody can treat this. Your career's over. Concentrate on something else.
Call Lisa.
Yeah, exactly. So we've had that several times, and they go on to play college sports, and
awesome.
and they keep going on. So getting that hug at the end when they're all they're rehabbed and they feel great. There's nothing better than that.
Did you see the way you smiled when he said that?
Yeah.
But that's the thing, because it means so much to you.
Yeah.
And I think that's really one of the things that sets this apart, your practice, Dave, apart, Paley, and you, Dr. McVicker, apart, is it is your life. I mean, it is really helping people, and that's what this is all about. It's why you get into this in the first place.
Yeah.
But maintaining that focus through a career on the human side of it is really, it's so commendable because it's moved so far away from that. But you guys keep focused on the right thing here.
I think if you don't, you get burnout.
That's what happens.
You gotta love what you do.
Yeah.
And Zach does, and it's consistently. Everyone's excited when they come out and they first start practicing.
Yeah.
And just a little shout out to Wade Van Sice. He's a friend of both Zach and I's. That he came down first and then brought Zach into town. So, but I was thinking about this, and I know this has direct impact and it's directly correlated. So I thought I'd bring this up. But Mike,
Yes.
what did one snowman say to the other snowman?
What did one snowman say to the other snowman, Dave?
Hey, do you smell carrots?
Oh, God. And yet I love it. And as always, I'll probably use that somewhere.
Yeah.
I'll credit you, Dave. Again, I love this show because the information's amazing. I'm going to have to stop into other places.
Thanks,
you guys will
Dylan.
have a field day with my issues. But, reach out. Do it before it gets too late for these things. Things can be dealt with so much more easily early on. You can reach out to First Rehabilitation of North Palm Beach, firstrehabnpb.com. firstrehabnpb.com. That's where Dave is. 561-624-GAME. 561-624-HAND. Also 4263. And you can call Dr. Zach McVicker at Paley Orthopedic and Spine Institute. 561-844-5255. Go through those prompts till you reach Lisa Lewis, the all-star administrative assistant, and she'll get you pointed in the right direction on this as well.
This doesn't usually happen, but next week I'm having somebody. I've had a lot of questions. We spoke a little bit about different peptides.
Oh, yeah.
And people are getting into these peptides, and they're getting into the different what kind of peptide to take for which.
Right. What does?
Well, I have somebody that's been doing it for 26 years.
Wow.
So people are getting into it because there's a train that's going along with this that a lot of do this, and he does hormone replacement and everything like that. But I'm going to have him on, Paul Joyce, and he'll be on next week if we could get him up away from golf early. I just wanted to give a shout out because I've had a lot of questions on that, and I know a little bit about it, but I know enough to know that I don't know enough about it.
With that topic, I mean, that's on everybody's lips right now.
Yeah.
And man, I love it. Maybe I'll get a shot live. This has been a wonderful episode of Pain to Power here on Legends. 561-624-GAME for First Rehab North Palm Beach, and also 561-844-5255 for Paley Orthopedic and Spine Institute. I'm Mike McGann. Thanks so much for being here for Pain to Power. Gentlemen, as always, thanks for being here.
Thanks for having us.
And I'm Mike McGann. Don't go anywhere. Lots more legendary programming on the way.